Hello, I am Dr. Jean Kuttner and I am the president of SGIM. I am hosting today's virtual Q&A, Dispelling Disinformation in the Time of COVID. I am a professor in the School of Medicine at the University of Colorado School of Medicine in the Division of General Internal Medicine, and I'm also the Chief Medical Officer at University of Colorado Hospital. Now, we all know that misinformation can be dangerous, not only for the general public, but also for medical professionals working directly with patients and in research. Combating false information can lead to a safer environment for all of us. I'm going to be answering questions that our members have sent in and give guidance to the best of my ability on how we can handle this disinformation better. And I want to give a thank you to our members who sent in questions. And like I said, I'll do my best to give some guidance. So I will jump right into question number 1. Eventually, we will have a vaccine for COVID-19. What strategies must we as physician community employ to build trust with communities so that when a vaccine is available, the public will trust us that it is safe? Specifically for underserved communities that may fear institutions in general. Now, this is clearly a timely question, and concerns about vaccines and trust in vaccines has been an issue prior to COVID as well. And interestingly, I was just having a conversation this morning as we are working on our recruitment strategies as one of the sites in a vaccine trial that will be opening in July, and particularly if we are going to be potentially recruiting from underserved populations and recognizing the potential mistrust of trials in general, and particularly potentially of vaccines. And I think, like most issues in terms of building trust, we first need to understand and listen and understand where those sources of mistrust are coming from, and particularly as relates to this vaccine. And I think making sure that we are engaging communities now so that we can address those concerns so that we're not just starting to address them at the time that a vaccine does become available. I also think that actually engaging those communities that don't have the trust in part of the trials stage of the vaccine may also be helpful. So like many things, it comes down to having the data, communicating, listening, and this is something absolutely we need to anticipate now before the vaccine does become available. So question number 2. How does one handle the politicizing of research? For example, the backlash against hydroxychloroquine has interfered with the ability to do a prevention trial, and it does not help when poorly done research gets media attention, but not so much when they are retracted. I think there's a couple of items here. One, I think that we, as investigators, need to stay true to our science and continue to uphold the highest standards, whether it is studies that we ourselves are conducting, studies that our colleagues are conducting and we are supporting, or when we are potential peer reviewers for a journal or journal editors. So one is our obligation to the science and making sure that the science itself is as strong as possible. I think also speaking out. I know there was recent concern about some articles that have since been retracted from 2 well-known journals, and it was really the speaking out by people that were concerned about the quality of those studies and the data behind them that ended up in the retractions. So I do think we need to stay true to the science and speak up when we have concerns about the qualities of the science. As for the politicizing of it, I do think the more that we can stick to the data and keep that message clear of sticking with the actual data and the evidence, the better off we're going to be. Question number 3. How can we trust guidance from the CDC when politicians intervene to control what they can say? It's a really tough question. I think we look to the CDC as our sort of source of truth and guidance, particularly in the setting of a public health emergency. And I think we still need to stick with the evidence that is behind the statements. And I think also recognizing when there are inconsistencies and bringing our own perspectives based on the evidence. Our head of infection prevention here at our health system, keeps talking about going back to the basics, going back to what informs us on a daily basis pre-COVID, and that is relying on the evidence and relying on our clinical judgment as well. And when there are inconsistencies, identifying those and addressing those. So I still think that we need to rely on our institutions and rely on the smart people, some of our colleagues that are there within institutions such as the CDC doing this work. Question number 4. What is the best way to make sense of data being reported by states when it varies so much and when what is reported could be controlled by politicians? I guess I would say that I struggle with interpreting the data as well. I think understanding the data within my own state and understanding the data sources and how it's being interpreted and reported. I will say that we are doing our own sort of data reporting and modeling within our health system, and we're also working closely with our School of Public Health that's doing the data modeling for our governor, so that we really understand what those data sources are. I think if nothing else, we've learned through this pandemic that we need to keep our science brains on and be making sure that we really understand the data before we rely on it too heavily. So I think understanding the limitations of those data are really quite important, and to the extent possible being able to have that voice within our own states about how data are being collected and reported. Question number 5. Why can't we count on the virus going away during the summer, and how strong is the evidence on the effectiveness of social distancing? Well, I think we can't count on the virus going away during the summer because there's no evidence that the weather is going to influence the infectivity of this virus. I think often we see that influenza decreases during the summer. People have less close in contact with each other. We also know that people still get colds in the summer, so I don't think that we can count on the virus going away in the summer just because it's summer. I think actually the worry about it not going away in the summer is that we're having summer coinciding with people having a bit more freedoms and being out and about, and the question is what effect will that change in the extent to which people are staying at home, change what happens with the virus. I would say the evidence around social distancing appears to be pretty strong, both in the published literature in terms of the virus spreads. I would say, as well as in what we've seen as social distancing has gone into effect in states, and seeing the flattening of the curve and the decreasing transmission of the virus. So I would say that my continual message anytime I've been put in front of the media is that we want people to be able to get out and have some life back, and the need to continue that, so that social distancing so that we do not have a significant resurgence. Question number 6, how do you target misinformation on social media that is posted by friends versus random neighbors versus random people? In other words, various degrees of separation. If it's a personal question, I would say that I am not one who tends to respond on social media. My personal approach is more to reach out to people, i.e. friends and random neighbors when there's misinformation, and not get into a social media battle with people. I think that there are varying approaches to that, and clearly has to be an approach that you personally are comfortable with. I would say that over the course of the pandemic so far, when there has been postings, for example, by members of our faculty that may have been spreading information, I've actually gotten on the phone with them and talked with them about it, and discussed the implications of postings on social media. So I think it somewhat depends on your comfort level and who the person is, as well as what your relationship to that person is. But I certainly am comfortable reaching out to friends and even random neighbors about misinformation. And I think it's a little bit up to you to what extent you want to get into a battle on social media, and whether it's helpful to correct people on social media or simply put in links to accurate information in your own social media postings. Question 7. How do you target misinformation on social media that's being shared by other physicians? An especially disturbing thread was on a recent Facebook group where vitamin C, gargling, zinc, antioxidants was being touted as treatment by physicians. I guess, again, me personally, I would not get into a social media battle. I would instead spread positive information and correct information through social media, rather than getting in a back and forth on a Facebook posting. I do think that being able to get out the accurate information is probably more important than trying to get into a social media battle. Question 8, how do you check your own anger or frustration when replying? I was actually on a call earlier today with a national group, professional group, and we were talking about the value of writing out your first response and not sending it, putting that one away, and then writing out the response that should be sent. So I think it's okay to vent to your close colleagues, vent in an email that only goes to yourself, or a document that only goes to yourself. But I don't think having the anger and frustration expressed in, say, a social media response, or any other kind of written or public response is effective. I think it's much more effective to have a calm, measured, and solutions-focused response that relies on the evidence. Question number 9, how can we engage with posts or articles that spread conspiracy theories or dangerous misinformation around COVID-19? And I think it depends on where the posts and articles are. I do think having informed, thoughtful counter opinions that include the actual evidence, I think is one way to go. I think depending on where the post is, it would be to contacting either the owner of the site or the editor if it's a newspaper, etc., to be able to ask for the opportunity to be able to get true information out there. I think the more we can counter the misinformation campaign with true evidence, measured thought, and our professional perspective, the better off we can be. In fact, one of our SGI members, John Ayanian, in response to the call for questions, pointed out that there was a nice post in, I'm just going to pull it up here, a nice post in JAMA Health Forum from mid-April entitled Educate, Amplify, and Focus to Address COVID-19 Misinformation, that was written by Drs. Valerie Earnshaw and Ingrid Katz. And I think it provides sort of a nice reminder that people overall actually trust us as physicians and do rely on us for accurate information. So I think it is our responsibility to get that accurate information out there and keep having that voice, and not just do about it, but to have a voice. Well, thank you all for all of your questions. I hope that I was able to offer some insight in, I don't know if it's how to best respond, or at least my thoughts about responding. I know the frustration of this disinformation can cause, and it often feels like an uphill battle, but we all play an important part in our communities as physicians, both in person and online, in making sure that science and data is what drives discussion and public opinion. If you'd like to hear more, like I said, I can refer you to the JAMA Health online article. I think is a nice place to go. And I think continuing this conversation and continuing to get out the real information, evidence-based information, even though the evidence is changing rapidly, it's really our obligation as physicians. So thank you all, and thank you all for everything that you are doing on a daily basis.